WCEG network on the WCEG Talk Radio. We are the worldwide community empowerment group where we speak life into the community. I am Dr. Dolapo Babalola, aka Dr. Babs. I'm a physician and I'm the owner of Life Wellness, which is a membership-based, holistic, and integrative direct primary care practice in Marietta, Georgia. So it is my honor today to be your show host for this evening's segment, The Holistic Perspective. We are here not only to enrich you, but to provide information that inspires you and helps you to take action, right? So this month, January, and Happy New Year, by the way. Yeah, so January is Cervical Awareness Month. And I thought that, let's talk about cervical cancer. Let's talk about pap smear. Let's talk about why a woman will come to her doctor and say, I need a PAP or I need a pelvic exam. So we're going to talk about all of that today. But the question I want you to bear in mind is, when was your last PAP? Have you had a PAP? Have you had a pelvic exam? All right. And so this evening, we're going to talk about what a pap smear is and what is the indication for getting a PAP. Is it everyone that gets a PAP? When do you stop having a PAP? I'm also going to share the reasons for the PAP, right? And also, cervical cancer, what are the treatments? What are some of the symptoms? And then commonly asked questions. But before we get to that, I would like for you to tag a friend, a neighbor, and let them know that the holistic perspective is up on the WCEG radio. We are live on all social media, whether it's YouTube, Instagram. We have a YouTube channel as well. So, and it also a free app, so free mobile app. So please, we want to make sure that you don't miss out on anything that we're going to be sharing about. Not only is it going to be meaningful, but it's going to be impactful. All right. Now, two quick announcements. I want you to know that any information that is shared either by myself or guests is not intended as medical advice, and it's our opinion and not necessarily the opinion of the WCG network and management. I always like to start with a quote, all right? And the quote for today is by Michelle Obama. Communities and countries are ultimately the world's only as strong as the women. So let me say that again. It might have sounded a little off. So communities and countries are ultimately as strong as the health of the women. All right. So this is women power today because we're talking about cervical cancer. All right. So I want to dive into the studies, right? I think it's very important for me to emphasize the studies, and I'm going to share my screen so that, we can look at this together. All right. So screen, let's see, make sure that you can see it. Make sure you can see present. Okay. And let's make it bigger so that you can see my screen. All right. So what I want to start off with is this slide that gives us an idea of just how many people are exposed to cervical cancer. So 4.4 million women are exposed, and it's increased. Unfortunately, there's that 1.7% increase, and it's typically the age range 30 to 44 years old, right? And the question is, what are we screening for when we do a pap smear? We're screening for cervical cancer. Cervical cancer is caused by a virus known as HPV, the human papillomavirus. And the guideline is, again, we always talk about prevention, right? So prevention is better than cure. So when we start screening, there was a time when we started screening at 18. It was less than 18. And then the guidelines changed that we start screening at 21. Based on this screen here, you see that you're actually at 21, you screen every 3 years, okay? You're not checking for the HPV virus, but 31 to 65, you check with a HPV virus. So if you are within that age, anywhere from 21 to 65, and I'll share a little bit of caveat to that, you should be getting a pap smear. The question then will be, how often should you get a pap smear? Again, anyone from 21 to 30, it's every 3 years, okay? Provided there's no abnormalities, so provided they don't find any abnormal cells, you are good for 3 years. But once you're over 30, then you have that checked every 5 years, provided there's a HPV. And so this diagram over here just highlights, and I hope it's big enough. Let me see if I can expand it. I'm going to move this to the side. Okay, so to expand it, over here, you see what I was just sharing, that you, for age 21, no screening, and there are different guidelines. So you want to just make sure you know which guidelines. I had a patient that told me that she's getting pap smears every year. The guidelines have changed. You shouldn't be getting pap smears every year unless there was something they were monitoring and checking. All right. So that's something that you should be very mindful of. You see over here, I said ages 21 to 29, you get it every 3 years. If you're between 30 and 65, you get the HPV, as you see over here. That's a PAP and a HPV. And in case you're wondering, what does that look like? What is done? So it's pretty much of a specular where your doctor will have you, assume the position. And you want to make sure that you're not getting a PAP when you're on your cycle, whether just a few days before your cycle or a few days after, because any form of blood can contaminate the site. So that's one thing. You want to be very mindful of that. And then when you're getting the PAP that day, it's about different, whether it's LabCorp or Quest, the data I'm showing you is from Quest. They have a specular. It's just a brush that will go to the mouth of the uterus. So the mouth of the uterus has the cervix, and that is where the brush is going to go. And so you're just trying to see what cells that you can capture. And that is what is tested to see if it is HPV, which is the virus that is associated with cervical cancer. Now, the question that comes up typically is, well, I don't have a uterus. Why do I stop getting a pap smear? So the answer to that is, depending on the reason why you had a hysterectomy, will determine if you still need to have some form of pelvic exam, okay? So for instance, if fibroid was the reason why, like excessive bleeding was the reason why you had a hysterectomy, then you don't need to have a pap smear, because if it was a benign course, that was the reason why you had a hysterectomy. But if the reason why you had a hysterectomy, or maybe your cervix was left behind, was because of some form of cancer, which most times if there was cancer, they would just take out everything, then you don't need to. So you just have to be very mindful. 65 is the age where cervical cancer begins to decline. So that's why the age is you stop all form of pap smear screening at 65. But having said that, it could be stopped earlier if you've had a hysterectomy. But we have to understand what was the reason for the hysterectomy to determine if you will still need to have a pap smear. So let's talk about symptoms. What are some of the symptoms? How can I know? Now, I don't know if you followed the story of, it was a pup, I forget her name now, but she, oh my goodness, she was having excessive bleeding. And unfortunately, she wasn't going, I think the way the story played out, a young, beautiful African-American lady, it was last year, the beginning of last year, she died of cervical cancer, but they misdiagnosed her and thought it was a fibroid. So that's one of the symptoms of cervical cancer, is excessive bleeding, uncontrollable bleeding, weight loss, back pain, all of that. But she actually, because she was having excessive bleeding, there was no information about whether she ever got a pap smear, because if she did get a pap smear, they would have seen the abnormal cells. She ended up having a pap smear, and then they diagnosed cervical cancer. But fibroid can cause bleeding. There's so many things that can cause bleeding. So you always still want to get a pap smear. Don't avoid it. I know it's uncomfortable. You have to sit, have your legs wide open in the syrups, and then you feel uncomfortable. But the discomfort that you get for at least knowing that you're clear, it's so worth it. And now that we don't have to do it every year, it's important that you get this done. So some of the symptoms, like I already said, there is, the question is genetics involved? Because of the HPV, we do see multiple partners, unfortunately, increases the risk of HPV, increased partners, early sexual history. Those are also risk factors that we need to be mindful of. All right. Now, question always comes up. I'm going to go into commonly asked questions other than the one, how soon should I get a pap smear? When should I stop? The question that comes up is the HPV vaccines. All right. So HPV vaccines, when do we get it? Do I recommend it? It has been shown that it does decrease the incidence of cervical cancer, which is caused by the HPV virus, right? The human papilloma virus. So HPV vaccine it was started off for our girls, our young ladies from 9 to 26. But as you know, we're in a lifelong learning environment. There's always some new research. And so we found out that boys could also benefit from the HPV vaccine. So you definitely want to talk to your healthcare provider to see if you qualify and how many doses that you should get. All right, so that's about the HPV vaccines. Importantly, to know that it does decrease the incidence of cervical cancer. Certainly, you want to make sure, I mean, for any of the young ones listening, to ensure that we decrease the risk of sexually transmitted disease. Now, I want to shift gears. That is about pap smear. This is Cervical Cancer Awareness Month. If you haven't had your pap smear, if there's any confusion about it, I hope that this has helped. Again, starts at 21 till 30. You do it every 3 years. And then after 30, after 31 to 65, you get it every 5 years with a HPV. Okay. Now, if they do find anything abnormal, then the guidelines will change based on what they find. So as long as your HPV is negative and you have abnormal cells, there's so many steps around there that you might just have to repeat it every year. You might have to get some of those cells and do a biopsy and see, or remove the cells. So there's so much treatment modalities that I don't want to complicate this session. I just want the important thing for you to know is that you need to get a pap smear. Now, I want to shift gears and talk about just women all together in terms of our cycles, in terms of discharges and stuff. I find that women generally, not all women, but some women will tell you, I want a pap smear. And meanwhile, they're not asking for a pap smear checking for HPV. They're actually asking because they have, some discharge, and they're concerned about the discharge. And they think that every discharge requires a pap smear. They're two different things. It's not the same. So let me share some light about a discharge. So for women, we naturally can have a discharge because of our cycle, because of all the hormones, right? So there's a period in our cycle. So we have a 28-day cycle. So the first half of your cycle, which is called the follicular stage. And then you have the second stage, which is called the luteal stage. So during the follicular, your ovaries are building, it's growing, it's maturing. And then when it's about to, before ovulation takes place, then you feel lubricated, you feel a little more discharge. The only time you start getting worried about that discharge is if it is has a fishy smell, if it is cottage cheese white, if it is painful, that area is red, that is when you get concerned. If it is not any of those things that I've said, then you should not be worried. All right, because depending on which part of your cycle you're in, you could have a discharge. Now, as we age, as we get older, perimenopause age, because the estrogen is decreasing, you might have some dryness there. So even if your cycle, which cycle usually ends an average of 52, but the range is between 45 and 55. So 45 and 55 with an average of 52. Anywhere around there, you might be feeling dry. So you're not feeling as lubricated as you used to. But I think it's so important for you to know that as long we will have discharge, we just feel more lubricated. You're more, you just get a lot more discharge depending on which part of your cycle you're in. So let's talk about the three types of discharge. There's one called bacterial vaginosis. Okay, so bacterial vaginosis is when the pH of the vaginal area is altered. And it can be altered for a few reasons. Maybe you bubble bath, you do a lot of bubble baths, you douche, you've changed your soap. Yeah, so some of those things would change the pH of the vaginal area. And so you're overgrowing, the bacterial vaginosis. And that can cause a fishy smell. It can look a little creamish, right? It can cause some irritation. That is not sexually transmitted. That can be treated with flagell. And how do you know? Other than the description that I've given you, you can check it on the microscope to see if you see the bacteria that we're talking about. So that's one, bacterial vaginosis. For my patients, I certainly would encourage them to have a healthier, vagina flora, right? Not altering it with double, douching, or because the vagina cleans itself out naturally, but not douching, bubble baths, all those things in excessive amount. But again, treatment with flagellum. Now, the second discharge that I want to talk about, that sometimes people will come and say, I want a pap smear. And then when you ask them, when was your last pap? It was like, oh, it was recent, a year ago. And then they tell you they have a discharge. Then you know that that's really what they want. So the second one is candidiasis. So that's a yeast infection that is common for several reasons. If you've just recently had an antibiotic, so antibiotic unfortunately alters our gut microbiome, it alters our vagina flora. And so what happens is that you develop these yeasts and it's very painful. It makes the area red, you want to scratch, it's cottage cheese-like. So those being recently on antibiotic, if your immune system immunocompromised, could also do that. Diabetes, unfortunately, can increase anytime you have increased sugar. That kind of builds when you have too much sugar, it builds yeast overload. So that needs to be treated. Some people get over-the-counter monostat, but some people might need something more than just the monostat. You might need a tablet, a diflucan. It comes in a tablet that would help to get rid of the yeast. It could also come in an insert. So you definitely want to talk to your doctor about that. But that's what that looks like. And then other discharges is one called trichomonas, and trichomonas is sexually transmitted. The yeast is not sexually transmitted. So trichomonas is one that is sexually transmitted. But what we find with the trichomonas is that it can be in your bloodstream for a long time. So I've had where people, partners are like, oh, you gave it to me, you were cheating on me. But it stays in the bloodstream for a while. So there's really no telling who got what from who. So I always just say that needs to be treated adequately. It needs to be both, the partner has to be treated if it's diagnosed in you. Now, how do you know trichomonas? Trichomonas is very creamy, greenish, very, very, it doesn't have the fishy smell like bacterial vaginosis, but it's just kupus, very, very excessive discharge. Sometimes it looks greenish. So that's trichomonas, sexually transmitted. You need to be mindful. So these are some of the discharges you need to be mindful of. And of course, gonorrhea and chlamydia, those are things that need to be checked for to make sure that you don't have any of these. So these are some of the women's health. Now, I always like to talk about things that we can all as women incorporate into our health that would build a healthier flora. And so foods that are so important are vegetables. I can't overemphasize it. When we eat more greens than animal product, it helps to stabilize our hormones, right? Because if we're eating a lot of animal product, unfortunately, if it's not even organic and we don't know which hormones and all of that is pumped into it, that can destabilize our women's health altogether and mess up our hormones. So you want to eat more plant-based foods, right? So that's one thing. You want to make sure that you're also having nuts and seeds. Seeds like flax seeds, chia seeds, pumpkin seeds. Those are also very good to help with our or not just the gut health, but also down there, our women's health, right down there. It helps to stabilize our hormones, helps to stabilize the secretion. So you want to make sure you have at least one serving of some form of seeds, right? It has high fiber, it has the omega-3s, and it helps with stabilizing your hormones. Okay, so that's the seeds. The nuts are also good, like walnuts, almonds. Those are really good, one serving. They're high calorie, so you just want to be very mindful of that. So nuts and seeds. And then you also, another part that I always like to emphasize is making sure that you are eating some form of legume, beans. Those are really, really good. They help to decrease any form of constipation because you have high fiber, so you're not straining. All right. So again, let's just recall everything that I've just said. Increase your plant-based foods, right? So your serving of vegetables, if you can at least have one serving of spinach and kale, that is so good for your gut health, is good for your vagina health. So 3 at a minimum serving, and you want to increase the diversity by having more colors, 5 to 7. You also want to have your fruits. You want to have your 1 serving of beans, legumes. You want to also have your 1 serving of nuts, 1 serving of seeds, and then your whole grains. Okay, so I think I've covered pap smear. We've talked about some of the discharges that we see. Now I want to share just overall what things that we need to be very mindful of as women, especially during our cycle. There are different things that happen, different wavelengths that tend to happen based on our cycle. So when you talk to your doctor, a lot of times we don't necessarily have to check your hormones to know where you are. Just asking you questions and getting the symptoms is sufficient enough. But if it's not clear, it's not really clear what's going on, then we can check your hormones. But you definitely need to work with a doctor that is comfortable checking and knows how to interpret what's going on with you. All right, so those are some of the things that I wanted to emphasize today. I think it's important that we are empowered with knowledge that would help us to show up at our finest, right? Show up at our best by being equipped with knowing when to get a pap smear. Other screening for women is certainly the mammograms, right? I know October, we just celebrated the Mammogram Awareness Month, Breast Cancer Awareness Month. That is certainly one that we need to be mindful of, mammograms. DEXA scan, we do that at 65 it's like a birthday gift at 65. If there's a history of fractures, you want to do that earlier than 65, but these are some of the things that you have to pay attention to for women. All right, so mammogram, DEXA scan, colonoscopy is also a big one. There is a month that is dedicated to just colon cancer screening, but I just want to bring it up here since we're talking about all things pertaining to women's health. So colonoscopy, again, just a friendly reminder, it's the beginning of the year, get these done. The guideline is at 45, you get them, and it's every 10 years, provided nothing is found abnormal. Okay, so I believe I'm open to questions. I would like to take some questions. Let's see if there is any in the chat box. I think I've covered quite a bit of the commonly asked questions that come on my end about pap smears, about the different types of discharges. Yes, one that and thank you. I see a question that has just come true about what are the treatment options for cervical cancer? Yeah, so again, it's back to there's several treatment options, just depends on the stage and what is found. The cervix is the mouth of the womb, right? So the uterus is, I wish I had a picture. So the uterus is like this, and at the bottom is the mouth of the womb. So typically the whole uterus is coming out, including the cervix. The question is typically, would you leave the ovaries? It really depends on the extent of the cancer, but that's the treatment, is just taking it out, take out the cancer source. Sometimes there's radiation depending on the extent. So those are the things to be mindful of in terms of the treatment, radiation, chemo, just taking out the womb itself with the cervix. A question came true, thanks for the question, about causes of cervical cancer. As I mentioned, again, it's the virus. The virus causes cancer. So the virus is called the HPV, and so that causes cervical cancer. Again, other things that we're finding, smoking, unfortunately, does increase the risk of cancer. Smoking has been shown to increase the risk. HPV, sexually transmitted disease, all those things are things that we've seen that has led to cancer overall. And I mentioned some of the symptoms, so we want to also be mindful of that. But you see, the good news is that if we are at least checking, then it's unlikely that we will be caught unawares, right? So we need to check. HPV, HIV, family history is also a big one, but the top out of all of them is HPV. And that's why, there's a strong advocate for getting the HPV virus, the vaccine, as well as making sure that we test cervical cancer testing, and cutting back on alcohol and smoking is really the big one. All right, let's see if there's any other questions. Thank you for that. I think, yes, okay, good. I see another question about cervical, and this is all around that they've had pap smears every year. And I actually alluded to this, that I've had a patient tell me that they always are HPV positive every time they do it. So they always tell them that they need to just check it every year. So for people that are HPV positive, you don't want to sit on it. You don't want to mess with that. You want to check. You want to do what we call a colposcopy. So colposcopy is doing a biopsy to see if there's really cancer, because again, it's just a detection of the cells, but you really want to do a biopsy to see what's the extent of the HPV influence on the cervical tube. So definitely you want to check the HPV, and you want to do a colposcopy. Okay, so I think that pretty much covers everything that I have for us today. It's women's health, and I really want to emphasize that, please, please, please. I find that people still do not understand what a pap smear is and the relevance of a pap smear. Please let us get our pap smear. So the question I'm throwing at you again today, this evening, if you have a woman in your house, a sister, a mom, an aunt, please ask them if they've had a pap smear. Pap smears are from the ages of 21 to 65. And depending on the age will determine how often how often they get it. And also will determine, based on the results, will determine what will be the next step. Okay, I like to leave with this great nugget that comes from Harriet Brochet Stowe, and it says, a woman's health is her capital. I think that's really cool. A woman's health is her capital. And so the one that I read earlier on today was from Michelle Obama, that said communities and countries are ultimately as strong as the health of the woman. So I hope that this episode has brought some clarity to you if you're listening, or if you're listening actively or as a replay, for you to ask yourself the question, have you had a pap smear? And if you've had a pap smear, don't say they didn't tell you what the result is. Ask, what is your result? Because I see this happen all the time. I ask them, did they do a HPV? Oh, no, I'm not sure what was done. So please, anytime you're, a provider is down there, you want to know exactly what are they doing. Are they checking for a discharge, or are they doing a pap smear? Because there's several reasons why, a provider is there. Just because they're down there in the pelvic area does not mean that they're doing a pap smear. So please ask for your results. Know what your results are, and don't just take it for granted. Oh, well, they didn't tell me anything, and you're assuming that it's good. Once you get your results, ask them, when is the next time that you're supposed to get checked again? All right. So I think that's a wrap for today. I want you to remember that you deserve to live at your finest, right? Because you are worth it. So I look forward to seeing you back next month. But until then, I want you to take care, and God bless.